Hi everyone, this is Xueqin Huang from the First Affiliated Hospital of Shantou University Medical College. Today I will talk about vital signs, the measures of the body's most basic functions. Let's begin with the case in our department. A 65-year-old patient is recovering from a myocardial infarction. He complains of new chest pain and trouble breathing. The nurse observes that his hands and feet are cold, and his breathing is rapid. What would be the most appropriate response of the nurse? Yeah, that's right. We should first take the patient's vital signs as baseline information. These are our learning objectives for today. First, you will be able to describe the components of vital signs. Second, you will be able to identify the variations in normal body temperature, pulse, respirations, and blood pressure from infancy to old age. Last, I hope you will be able to verbalize the steps using in assessing vital signs. So, what are vital signs? Traditionally, vital signs include body temperature, pulse, respirations, and blood pressure. However, in recent years, many institutions have designated pain as a fifth vital sign and being assessed at the same time as the other four. Today, I will focus on the first four items. Pain assessment will be covered in a later section. Assessing vital signs is a routine medical procedure. It helps us determine the human body's internal functions. The first vital sign we are going to talk about is body temperature, which reflects the balance between the internal and external environment, or balance between the heat produced by and the heat lost from the body. It can be measured in two different scales, Celsius or centigrade, and Fahrenheit. I hope you know how to convert readings between the scales. There are a number of factors affect body's heat production, such as basal metabolic rate, that is BMR, muscle activity, thyroxine level, sympathetic stimulation, etc. Heat is lost from the body through radiation, conduction, convection, and evaporation. When the amount of heat produced equals the amount lost, the person is in heat balance and maintains a normal temperature. The normal body temperature of a person varies depending on gender, recent activity, food and fluid consumption, time of the day. Besides, the stage of the menstrual cycle can affect body temperature of women. Nurses should be aware of the factors that can affect a patient's body temperature. There are two kinds of body temperature, core temperature and surface temperature. Core temperature means the temperature of the deep tissue of the body. such as the abdominal cavity and pelvic cavity. It remains relatively constant. By contrast, surface temperature means the temperature of the skin, which rises and falls in response to the environment. Normal body temperature can range from 36 to 37 degrees Celsius for a healthy adult. A person's body temperature can be taken by oral, tympanic, rectal, or axillary route. Do you know which of these are core temperature or surface temperature? That's right. The tympanic and rectal routes indicate the core temperature, and therefore higher than the other two. There are two primary alterations in body temperature: pyrexia and hypothermia. When the body temperature is above normal, we call it hypothermia or pyrexia, while hypothermia means a core body temperature below the normal limit. There are four common types of fevers, which are intermittent, remittent, relapsing, and constant. We should learn how to identify the differences among them. The second vital sign we are going to talk about is pulse. In a healthy person, the pulse rate equals the heart rate. However, in some kinds of cardiovascular disease, the heartbeat and pulse rates can differ. For example, a patient's heart may produce very weak or small pulse waves. It is not detectable in the peripheral artery far from the heart. In these instances, we should assess both of the heartbeat and the peripheral pulse. When we take a pulse, we should not only measure the heart rate, but also can indicate the heart rhythm and strength of the pulse. These are arteries that can be used for assessing the pulse. The radial artery is most commonly used because it is easily accessible. We often use the carotid pulse during cardiopulmonary resuscitation, in case of cardiac arrest. Other than the rate, we also assess the rhythm and volume of the pulse to detect whether it is regular or irregular, strong or weak. Now let's go through respiration, which we normally call breathing. Actually, one respiratory cycle consists of one inspiration and an expiration period. Which enable us to take in oxygen and get rid of carbon dioxide. From this table, we can see that normal pulse and respiratory rate vary with age. For an adult, a normal heart rate is between 60 to 100 beats per minute. A heart rate over 100 is called tachycardia, and it can be an early sign of shock. How it may also be a normal finding during exercise. A heart rate under 60 is called bradycardia, but it can also be normal for athletes. The normal respiratory rate in an adult is between 12 to 20 per minute. A rate over 20 we call tachypnea. Clinically, when we assess respiration, we should focus not only on the rate and the depth, but also the pattern. For example, someone who is in diabetic ketoacidosis will oftentimes breathe very deeply and rapidly. This is called Kussmaul respiration. All patients with severe head injury would have a crescendo breath followed by a period of no breathing, that is apnea. And that's called Cheyne-Stokes respiration. So the breathing rate and pattern will give you an idea of the patient's overall condition. Lastly, we are going to discuss blood pressure, which is measured in millimeters of mercury, that is mmHg. As you may know, there are two readings for blood pressure because of the heart contraction. When the heart contracts, the first sound heard is the systolic blood pressure, and the last sound heard is the diastolic blood pressure. The difference between the diastolic and the systolic pressure is called the pulse pressure. This table shows the classification of the blood pressure. Normal blood pressure is between 90/60 mmHg and 140/90 mmHg, but it varies person to person. Generally speaking, anything over that 140 for a systolic and 90 for a diastolic blood pressure is considered hypertension, that is high blood pressure. Low blood pressure can be a sign of hypovolemia, that is low blood volume, or a profound stage of shock. In summary, vital signs are a group of clinical parameters which are affected by many factors, such as age, weight, gender, and overall health. Let's come back to our case. On measuring its vital signs, we obtained the temperature 36.2 degrees Celsius, pulse 112, respiratory rate 22, blood pressure 80/60 mmHg. I hope you know which ones are abnormal. That's all for today. Next week, we will talk about how to take vital signs. See you then. Thank you.